Good afternoon. This is Thursday, March 26th. I'm Gary Pace, the Public Health Officer, and we're going to do the daily coronavirus update. Here with me is Priscilla Morales, who will provide Spanish translation and a separate video, and we also have closed caption on YouTube. So the current numbers, United States cases is over 80,000 now. Deaths have passed 1,000. California cases are 3,300 with 68 deaths, and there are 1,300 cases in the Bay Area. Sonoma County has 39 known cases, Mendocino has 2, Napa has 3. Lake County continues to have no confirmed cases, and we're one of only 14 of the 58 counties in California without a confirmed case. So the situation continues to escalate. I encourage you to continue to pay attention to what's happening in New York. Things are worsening there, and the healthcare system is nearing overwhelm. They're discussing trying to build 1,000-bed hospitals in each of the 5 boroughs in order to keep up. The Bay Area is probably 3 or 4 weeks behind New York, and this is what is influencing our thinking a lot in this area. So I want to talk a little bit about modeling. There's a lot of interest in the public health world where they're modeling likely scenarios of the increasing numbers of cases and sick people based on experiences in other places like New York and Europe. They then look at the gap between the expected needs in terms of hospital beds and ventilators and what is actually available at the time. These models show huge gaps between the available beds and the projected needs. Therefore, the state of California is starting to make plans to set up large hospitals around the state. There's a Navy hospital ship that's going to arrive in LA in April. Seton Medical Center in Daly City just opened up. And there's a site in Redding where they're going to try to put in 250 beds. There may be other sites planned that I'm not aware of yet. As you can see, there are no additional hospital beds being added in our immediate area. Both of our hospitals are actively planning on ways to expand their capacity if we get to the point where we need more help. Very important in this discussion is that estimates of the needed beds drop significantly if the shelter-in-place orders are put into place. There are fewer beds needed, fewer ventilators needed, fewer people's lives are at risk when there's good compliance to staying at home. This is a very important issue and reports to how critical it is for everyone in the county to stay home and to stick with the guidelines on social distancing. We are concerned with all the activity that was going on the past weekend, including many people apparently from the Bay Area that were out on the lake and in a bunch of other activities around the county. And this may end up leading to an outbreak here during the next week sometime. Usually there's a 5 to 14 day lag time after contact before symptoms really get going. So we might see this happening in the near future. Even if this is what happens, maintaining shelter in place and avoiding travel and social contact are still the most important things that can be done to slow the spread of the virus in the community. Also, if the virus starts coming in the area, it's very, very important to protect the vulnerable people in your family, the elders, those with underlying medical conditions, those with immune suppression. Keep them away from any sick people, wash your hands frequently when taking care of them, and all the other precautionary steps that you can take. We appreciate your cooperation with all the things we are trying to do to protect the population. For more information, go to the Health Department website. There's also an email address and a phone number that we are answering during business hours if you have specific questions. Thank you.